Hi, this is Dr. Paul Goldberg at the Goldberg Tender Clinic in Atlanta, Georgia. Here at the Goldberg Tender Clinic, we work to reverse chronic diseases, and we put a considerable focus on rheumatoid and other autoimmune disorders. Today, we're about to see an interview with Dr. David Tenner and Ms. Grizel Cologne, who came to see us from Florida, who had been medically diagnosed with rheumatoid arthritis. Now, as with most patients that we see who have been diagnosed with rheumatoid arthritis, Ms. Cologne had been administered a number of immunosuppressant drugs not to get you healthier, but to actually suppress the symptoms that the person has. These drugs in her case included Plaquenil and prednisone, the corticosteroid, and one of a class of biological drugs called Humira. In that same classification are other biologicals such as Remicade and Enbrel, and there's a number of other ones. They keep coming up with new ones all the time. Ms. Cologne has today, as you'll see revealed in the interview, experienced a dramatic turnaround in her condition, as we commonly see when we construct a recreation program for patients, where her rheumatoid arthritis symptoms are now entirely gone, and more importantly, even than that, she's experiencing vibrant health. She reports a 200% improvement and is entirely now drug-free. Here's our interview with Dr. David Tenner and Ms. Cologne.
All right. Hi, this is Dr. David Tenner. We are here at the Goldberg Tender Clinic in Tyrone, Georgia, just outside of Atlanta, where we specialize in the reversal of chronic disease. I am absolutely delighted to be joined today by one of our favorite patients, Ms. Grizel Cologne from Florida. She's here today about 18 months after she first came in, and she has a wonderful story to tell. Her case has been a rounding success, and she's going to share her experiences. So, Grizel, I want to turn the floor over to you and tell us what brought you in originally. What was your health situation at that time?
Wow. Well, when I first got here, I remember that I had just hit rock bottom. I didn't know what I could possibly do to rid myself of joint pain. I was experiencing fatigue. Whenever it was cloudy outside, I felt like I needed to crawl under my bed with a big blanket. I just didn't have a life anymore. And I was seeing a rheumatologist. I had gone through a whole series of meds. At that point was on Humira, and I just wasn't getting any better. And I just needed a solution, and I was very fortunate that I found you. And, that first visit gave me the hope that, we could really regain health.
And a lot of this started for you back in my notes indicate, back in 2014.
Yes, and actually it started in 2014 because I was diagnosed then, but it took me 2 years to get diagnosed.
So you were having a lot of pain prior to that.
A lot of pain, a lot of pain that I just really didn't know what to do with.
And how did that affect your ability to function? I mean, you're a businesswoman.
Well, I'm an event producer,
Mm-hmm.
so working was extremely painful, and actually it got to the point where I couldn't do that work anymore. So it really impacted my home situation considerably.
And you had been, at that time, you saw a rheumatologist.
Yes, I have seen rheumatologists. I have also seen, actually on the West Coast, I was seeing a rheumatologist that incorporated some other practices such as acupuncture and homeopathy. And so I had that for a while, but that wasn't really going very far either. It gave me temporary relief, but nothing long-term.
So we diverted her attention away from that and really started to explore the reason she developed this in the first place. Because the question we have when every patient comes in, regardless of what their condition is, hey, why did you get sick?
Right.
Why did this happen?
Mm-hmm.
You weren't born with this issue, so there's some set of circumstances that led to the development of this problem.
Mm-hmm.
That's what we need to figure out. And then secondly, rather than treat disease, which is a medical approach, we want to set about creating the right conditions to build health, and the word that we use, to literally recreate the body. So you get a new body, a fresh body with fresh cells over time. So in the recreation process and in working with us for the last 18 months, what have you noticed? What is different about your situation now than it was 18 months ago?
No pain in my joints,
Okay.
thankfully.
And you're off medication.
I'm completely off medication. The minute I got to a point with RA where I was weighing at 5'2", 205 pounds. When I met Dr. Goldberg and Tenor, I was at 165. And
What are you at now, by the way?
right now, I am at 115 pounds.
Yep. And her BMI is about perfect for her height. So she's at a very, very healthy weight. And the weight loss was a nice benefit of getting healthy. We never put people on a weight loss program. They get healthy and then their weight normalizes, which is what happened with Griselle. So Griselle has worked very hard. She has given it time. She's been very patient. And she's taken kind of the bull by the horns and understanding the things that we've told her and making application of them. And as a result, her body over time has been recreated, has been revitalized, has been restored. The disease process that had plagued her for so many years is now dissipated. And most importantly, she now knows what to do to take care of herself. So Griselle, I want to thank you for sharing your story.
Absolutely.
Your story, I'm hoping, will serve as an inspiration to other patients who are plagued with this type of health problem and other chronic disease. That yes, there is hope for you to get well if we start to investigate why you're sick and then do the right things to recreate the body and rebuild health. And so again, I very much appreciate you sharing your story, and we are absolutely delighted with the progress that you've made.
As
So
am
thank you
I.
very much.
As am I.